All right, welcome everyone. We've got the pleasure of having Abby Ingber, the Executive Director for Borderline Personality Disorder Alliance, on our show today in the healthcare series of the Dealmakers Table. So, Abby, welcome to the podcast.
Thank you so much for having me.
Well, as the Executive Director of, and I'm just going to shorten it, BPD, Borderline Personality Disorder, you lead an international organization that's dedicated to supporting individuals and families affected by borderline personality disorder. Can you tell us about the BPD's Alliance's core mission and what inspired its founding?
Sure. Thank you so much for asking this question. Our organization is in its 25th year, and it was started by a woman who was a clinician and researcher, and she realized the need to bring together family members, people with lived experience, researchers, and clinicians to all work together to enhance the quality of life for those living with borderline personality disorder. And she started the organization as an attempt to spread awareness and education around the disorder that is very misunderstood, and there's a lot of stigma around it. And what started off as a couple of conferences led to us putting on over 100 conferences over the 25 years, getting owning curriculum that is used to educate family members around borderline personality disorder, teaching them skills, psychoeducation, and while they're receiving support. And we have another program managing suicidality and trauma recovery, which is for parents who have a loved one who has experienced suicidality, the loved one has, and the family member probably does not recognize it, but they have acute stress disorder or PTSD from um, the situation that they were in. And again, we are teaching them psychoeducation skills and support, all really in an effort to enhance the quality of life for those most affected by chronic emotion dysregulation.
Great mission and vision of the organization. Thanks for sharing that. So let's maybe dive into that a little bit and understand it a bit more. I mean, when we met earlier, you highlighted that BPD is really the most stigmatized mental health condition. What are some of the key reasons for that intense stigma, and how does it impact individuals living with BPD and their families?
Yeah. So, borderline personality disorder is not really, a lot of people don't really know what it is. Even clinicians have received very little information in terms of their education around it. And because of a lot of the research that has come up in the past 25, 30, 35, 40 years, many people are still learning outdated information. So, borderline personality disorder is a condition that affects relationships. And it's really people who have really big, extreme, intense emotions and have trouble regulating their emotions. So this translates into the relationships with loved ones, working, really maintaining friendships, maintaining jobs. So a lot of people with borderline personality disorder, people kind of shoo them to the side and don't want to be friends with them, don't want to have them in their family, don't want to have them as their colleagues, where they really are very similar to a lot of people, just having very big and intense emotions and are sensitive people. So there is a lot of stigma, first of all, around the name borderline personality disorder. It really means nothing of what the symptoms are and what people are experiencing. So the name is an outdated term. Back in the day when they really did not know that much about borderline personality disorder, they thought that people were on the borderline of neuroses and psychoses, and that's where the name came from. It is not related at all to how a person is diagnosed or what the actual fact is. So just starting off with the name is very, very stigmatizing. Um, Also, the fact that people have trouble having relationships, holding jobs, there's a lot of stigma around that. And until about 35, 40 years ago, when Marshall Linehan created dialectical behavior therapy, there was really no treatment for people with borderline personality disorder. People with borderline personality disorder, about 10% die by suicide. It's one of the largest rates of any condition, ending up in people terminating their lives and attempting and completing a suicide. And that is also one of the reasons why it is very stigmatized. One of the main reasons is there is no medication to treat it, which means there is no pharmaceutical company out lobbying to raise awareness about borderline personality disorder. You have about 10 organizations in the United States, all very small nonprofits. We are the largest organization with a budget of about $750,000. And even that is not enough for us. In order to meet our needs, we would need to be closer to $1 million. And there's a couple of other smaller nonprofits with $20,000 budgets, $30,000 budgets, or $100,000 budgets. So there really is not any big power that, from big money coming in from research and pharmaceutical companies. National Institute of Mental Health, which in the United States funds a lot of research. Their research on borderline personality disorder is about 2 decades behind other conditions. So schizophrenia, uh, which is widely known, and there's a lot of money being pumped in for research for schizophrenia. Borderline personality disorder affects more people, about 1.6% of the population. So it's more than schizophrenia. And yet, in terms of the research dollars that's being devoted to research with schizophrenia, it is about $300 million. And with borderline personality disorder, it's about $30 million. So huge differences, and all leading to the stigma of the condition.
Got it. And I found that really surprising when we talked about that earlier, that BPD affects more people than schizophrenia.
Mhm.
So, there's obviously an impact on, what the consequences are for the BPD community. Can you elaborate on that a little bit more too?
Sure. So, a lot of people who have borderline personality disorder, they have been told that their feelings and emotions are not valid. And this can be done, on purpose, but it also can be done, not on purpose. So, for instance, we give the example of if someone with borderline personality disorder is watching the movie Bambi with their friend, they're young, people who are watching the movie Bambi are probably, 7, 8, 9 years old. And I'm going to give a little spoiler away for those of you who have not seen Bambi. In the movie, Bambi's mother passes away. She is shot. And someone with borderline personality disorder watching this movie, this is just an example, may have extreme emotions while watching this movie. And they are so sensitive to what happened that they may be crying. They may feel really unsure. They may be scared of what would happen, to their mother if they were in this situation. Fear of abandonment is a characteristic and a symptom of borderline personality disorder. So, that fear of abandonment, of losing a mother within the Bambi movie. And if you have two friends, two kids, two siblings watching this movie together, and one of the siblings is having these big, intense emotions over what is happening, their friend is going to look at them or their sibling and say, "You're being such a baby. Come on, it's just a movie. Get over it." And right there, you're creating an invalidating environment. You are telling this youngster that their emotions don't matter. Another example is if you're driving down the highway and you get cut off. A lot of times, this happens frequently to people. And, sometimes if you're in your car and this is happening, you may need to take a breath, but you continue driving on. Another example with someone with borderline personality disorder is that they need to pull over. They're not able to continue driving because their emotions are so intense and so big. And 3 days later, they still may be telling you the story of what happened because they haven't returned to baseline yet. Their reactivity is so high and they're still in that, state where they're still reacting, even though it could be 4 days later, a week later. And the reaction from the general public is very invalidating. If a friend said to you, you know, 2 weeks ago, I was driving down the highway and I was cut off and I can't drive because I'm so scared. And, their emotions are so big. Unintentionally, you were probably going to say something that's invalidating to them. And what happens with people with borderline personality disorder is they are invalidated over and over and over again in their life, that it gets to be so big and so huge for them that they don't know how to regulate their emotions. They don't know how to return to baseline. They don't know how to take their reactivity and to lower it unless they've learned skills. So this has a huge impact on people with borderline personality disorder. This has a huge impact on their family members. And unfortunately, many clinicians are not taught the skills. So someone who is going through their education and getting their PhD in clinical psychology or getting their PsyD and they've spent 5, 6, 7 years studying, most of them have not learned the skills how to treat someone with borderline personality disorder. So here you are with these huge emotions. You think something is wrong, and you go to doctor after doctor, psychiatrist, psychologist, social worker, one after the other, and they can't help you because they haven't learned how to help you. They haven't learned the effective treatments, they haven't learned the effective skills. So it's kind of a cycle, that people with borderline personality disorder get into, where they have these huge emotions. Their loved ones are invalidating them. The environment is invalidating them. Their friends are invalidating them. And then when they go for help and support, they're being invalidated again.
And
So
that really gets into the core work that the BPD Alliance is doing, right? And part of your signature program are focused on providing that education and support for the family members and the clinicians. Thank goodness, right? So why in your experience is it so critical to involve those family members in the treatment and support process? And what kind of resources do you and the team offer them?
yeah, so studies were done a while back, around the time that we were founded, basically showing that family member support really can help improve a loved one with borderline personality disorders. It can help improve their relationships, their condition, their understanding. So our goal is to promote understanding of borderline personality disorder, to teach family members and clinicians simple psychoeducation, like people with borderline personality disorder are not manipulative. Borderline personality disorder can be diagnosed under the age of 18. So all these stigmas and myths that are out there, we provide education. And then what we also really do is provide skills. There are skills that family members can learn that can help improve their relationships, and not just with their loved one with borderline personality disorder. What we're really teaching is life skills. And, I'm sure you've heard the word validation before. The question is, do you really know how to validate a person? It's not praise, it's not cheerleading, it's telling the person that you understand them. And this is something that should be taught to everybody. We have a leader of ours, a volunteer of ours, who likes to say that these skills should be in the drinking water. And we even tell people when you first learn the skills, not to practice them with your loved ones with chronic emotion dysregulation. Practice these skills when you're in the grocery store checkout line with the lady at the checkout counter, because they've been working all day and no one has probably validated them about their day and about what's happening, and letting them know that you really understand what they're going through. We recommend that you use these skills at work. We recommend that you use these skills with everybody in your life. And then when you've practiced them and you get your groove in and you know how to do them, then start using them with your loved one with borderline personality disorder and chronic emotion dysregulation. And you will see a huge difference, even if they're not getting treatment, even if they're not getting support. You being that one person for them can make the world of difference. So that's what we, are really out promoting. And then the other aspect of our programs and then the work we do is the support. We did one of these programs, and a family member stood up in the middle of the program and said this line, said, "We ain't get no damn casseroles." And I'm saying it that way because that's the way the family member had said it. Their next door neighbor, unfortunately, the daughter, the little girl, she was 12 years old, had cancer. And the family watched car after car stopping by with casseroles, with balloons, with flowers, with support, driving the other child, the sibling of the loved one who had cancer, to soccer practices and to school. So the family, the mom and dad, could focus on their loved one with cancer. And here, right next door, in the same neighborhood, right next door to the house, the mother and father were dealing with their child being in the hospital for suicidality. And what they heard was crickets. Nobody was offering to help. Nobody was offering support. And the family members didn't even know if they could tell their siblings, their mother, their best friends what happened because
Mm.
there's so much stigma around it.
Yeah.
And they said this phrase, we're not getting the support. We're not getting the people who can help us and guide us through this process. And that's one of the other things that we're doing. We're trying to build a supportive community for everybody touched by borderline personality disorder, suicidality, and chronic emotion dysregulation so that they are not dealing with this alone. And when you attend one of our programs, they're small group programs, you are getting to know our Family Connections program and our Managing Suicidality Trauma Recovery programs. They're small groups. So you're getting to know the people in your classes. And that, for many people, becomes their support system. And we have classes that happened 25 years ago, and 20 years ago, and 15 years ago, that the people are still connected and still talking and still dialoguing. And when something happens, they have someone that they can call and who will get it. And they can just be themselves in our community and in our space because we are there, no stigma, no judgment, with an ear to listen and skills to help.
And you were also mentioning health insurance companies as well. Yeah, they're getting it wrong too. And how does that lack of understanding from the payers create barriers to accessing the appropriate and effective treatment? And I guess what work is the BPD Alliance doing to help break down those barriers as well?
Yeah, this is a great question. In the physical health field, insurance companies understand what the diagnoses are and what treatment is needed. So if you have a wart on your foot, they're not sending you to an OBGYN. If you have something wrong in your muscles in your arm, they're not sending you to a dermatologist. So the physical health, if you have if you know what you have, you're going to a specialist who specializes in that area. Now, of course, in rural America, there's many, family medicine or general clinics because you may not be able to find the specialty, but those people are trained how to help in these broader situations. In the mental health and the behavioral health space, it is really looked at as one size fits all. So if you have borderline personality disorder or anxiety or depression, there's one type of treatment and you go for that one type of treatment. And that doesn't work with borderline personality disorder. Now, there is treatment as usual, which is better than no treatment at all for borderline personality disorder. And the best thing you can do is to get really specialized treatments for borderline personality disorder. There are many effective treatments that are out there: mentalization-based therapy, schema-focused therapy, transference-focused therapy, and dialectical behavior therapy. And these are available in the United States, but in really, really small pockets. So there's areas where you cannot find this type of treatment. And then on top of it, you have the insurance companies, which don't pay extra for this type of treatment. We've had family members who've had their loved ones in and out of the ER 8, 9, 12 times because the insurance companies would rather pay for an ER visit than pay for specialized care for borderline personality disorder. So there is a huge gap in the understanding with many of the insurance companies. And we are working with a couple of them to provide them education, to provide them support, to provide them resources so that they have a better understanding of how to help the patients. We have an insurance company that reached out to us recently and said to us, help. We have patients with borderline personality disorder, and we are noticing that they're in and out of the ER and costing us hundreds of thousands of dollars. What can we do? And we're working with them to educate them around dialectical behavior therapy and letting them know that there's research out there and there's statistics out there that if they pay for treatment for dialectical behavior therapy, the likelihood of their loved ones needing to go in and out of the hospitals and doctors and ERs is substantial. Our managing suicidality and trauma recovery program, one of the things when we were piloting it that we were studying was how many ER visits people made in the past year after the family members had taken the program. And there was a 70% reduction from before the program to after the program. And we're sharing statistics like that with them. And DBT also has these statistics in terms of, you know, the cost effectiveness. And unfortunately, it's knocking on one door at a time. So talking to one insurance company and then the next and then the next. And we're hoping to create a movement where the insurance companies do develop a better understanding of borderline personality disorder, understand that there is no magic pill, that there is no medication that can be taken. Although many people with borderline personality disorder are on medication for a particular symptom or for co-occurring conditions. And we're out there educating and providing this information through our advocacy committee with our partnership with many of the clinicians. We partner with an organization called DBT-LBC, which is the Dialectical Behavior Therapy Linehan Board of Certification, really on this work to get the word out there.
That's great. In terms of what you're trying to do, as a nonprofit, I know you mentioned you're really heavily reliant on fundraising, particularly from those who've actually participated in the program or have loved ones with BPD. What are the biggest challenges you face in securing the funding and expanding your donor base, especially given, the stigma that we talked about associated with BPD?
Yeah. There's a lot of issues in this area, and we're making some headway. Although we know just from the demand we get of the number of people reaching out to us, we are hoping to raise $1 million a year to increase our budget. We're currently at about $750,000. So there is that gap there, and even with $1 million, that's just meeting our current demand. It's not helping the millions of people, the over 5 million people that have borderline personality disorder. And then when you involve their families, it's closer to 14 to 20 million people that are affected in the United States. Part of the issue is we don't have any government funding, and many foundations have told us that we're too niche, in terms of borderline personality disorder, they are looking at it and, they hear schizophrenia so much more. They hear depression, they hear anxiety, OCD. They know what it is. So when we go in and meet funders, many times we're needing to educate them on what borderline personality disorder is, the facts, the truth about it, the stats about it. And once we get to meet them and show them the impact that we have and let them know that borderline personality disorder affects more people than, bipolar or than schizophrenia, we can really open the door and have a conversation. So we're really looking for people that are interested in partnering with us, working with us, learning together, and really providing that impact. And as I said, a lot of what we do and what we teach are life skills, and they are helpful and beneficial to everybody. Once people attend our program, we have a huge rate of them donating back. Our programs are all free. So they people can attend for free, and we did that on purpose because treatment for borderline personality disorder is extremely expensive. So we want to be a low barrier, low cost, get in the door, get help, get support. And the rate of people who donate back after they've attended the program is huge for us, and helps us. And we are, of course, looking for foundations who are willing to fund organizations that are under $1 million and can make a huge impact in the lives of so many families.
Speaking of that, right? So assume you mentioned you have the gap in terms of the funding. So if you had more funding, right, what are the things that the organization could work on, goals that you would have in the next 6 to 12 months that would actually leverage that increased funding?
So our programs that we offer, the curriculums that we offer, the family connections and the managing suicidality and trauma recovery curriculums, they're evidence-based. There's research studies about its effectiveness, over about 20 research studies about how effective they are. But it is a very high, intense, resource-driven program. So, like I mentioned, it's small groups. We have volunteer leaders who are running the groups, and our staff are, working as hard as we can to support as many people. Now, with technology, we would love to create a more self-paced version of the course and have resources available to people that are on our website that they can use without participating in the course and waiting. We do have a wait list for the course, so waiting, to get onto the wait list. So what we're looking to do is to use either AI or technology to really bring more of our programs to life to help more people as opposed to them waiting for a course to open up.
Fantastic. So maybe you've answered the question with this one, but if you could solve for one major challenge today for the team and the mission, what would it be and why?
So I think the funding would be the major challenge. We have the right people who can move us along. It's just needing the more resources, the more funding. We have our board is made up of clinicians, researchers, people with lived experience, family members. And all of these people give back because they've seen the impact. So I think, for us, there is just that gap between what we know we need to be able to meet the current demand, the current needs, and being able to offer more of these programs and more supports. And for us, we want to help these family members who really are in need and are in crisis and have nowhere else to turn.
I mean, obviously your work's so critical for so many, and for listeners or family members who want to learn more about borderline personality disorder, find support, or contribute to the BPD Alliance's mission. What's the best ways to connect with you and the organization?
Sure. So our website is actually brand new. We've launched it in the past couple weeks with a whole bunch of resources. We have the largest virtual library on borderline personality disorder in the world. So if you go onto our website, you can access resources and also find my contact information. The website is bpdalliance.org. And we hope that you will come and learn and, make use of our resources. And we also love everyone's feedback. So please feel free to reach out if there's a resource that you think should be added, or, something that we're missing, or if you need a better explanation about something that's on our website, we would love to hear from you.
Great. Well, Abby, that wraps it up for today. So thank you very much for coming on the podcast. Greatly appreciated. Glad we got some additional content and education awareness. And hopefully people can just seek to understand what people are going through in this space.
Thank you. A huge thank you to you. I mean, anytime we can talk about borderline personality disorder, and our mission, but mainly getting some facts out, and the truth out about borderline personality disorder is really helping us towards our mission of greater understanding. And, my hope is that if you know of someone or hear of someone with borderline personality disorder, you will engage with them compassionately after hearing this conversation.
Absolutely. Well, with that, we'll wrap it up. Have a great day, everyone.
Thank you so much.